The final day of the 102nd James W. Weiner Memorial Wellness Week here at the World of Wellness. And today, to round it off, we saved the best for last. An icon in our industry. And that word is not used very often. Dr. Weiner was one, and his colleague, Dr. Dennis Courtney. I've known him a long time. We've done a little radio together over the years. And Dr. Courtney has become the premier eye specialist in the country. And today he's going to give you a rundown of that and a whole lot more. I saw some of the preview. You don't want to miss this. Dr. Dennis Courtney, everybody.
Thank you very much, Joe. Ladies and gentlemen, thanks for coming out this morning. With these inclement conditions, you deserve an award yourselves for making it here today. I hope we spend some time together to bring you to an awareness that you may be unfamiliar with. But however, I feel that to round out your knowledge, which as a participant, even being in the building, you already, in my mind, have put yourself at another level anyway. Now I'm going to bring this to a medical head because as knowledgeable as you are about the nutritional aspects of optimizing your life, combating disease, allowing for longevity into the future, and so many different people who are in the Pittsburgh area have really been helpful to you to be able to bring that message home to you. The fact that you're even in this building today says you're already aware of one of the greatest companies in existence in terms of being able to supply you with these supplements to allow you to live that better life. As a medical doctor, however, and knowing full well, and no matter what I treat, and so look at me as a different medical doctor. A medical doctor, by the way, initially trained as an anesthesiologist. In that operating room, I used 4-tray toolbox. And in that toolbox was every IV drug known to man. And to do an anesthetic, if any of you have had the opportunity to be taken to the operating room, you met one of me right before you went in. And somebody like me made that particular event pleasant for you. A surgery was able to be performed. And in a very interesting way, you were able to reemerge from the anesthetic and life went on. However, the allure to me started to pull me away from the operating room after about 7 or 8 years. And it moved me out into the regular world of medicine because I had just had about enough of what I saw going on inside the confines of that hospital. The way I described it was surgery, and all that surgery does is clean medicine. There's always going to be the need for some skilled surgeon to perform literally a carpenter-like work on you. And because of his practice and his expertise, correct this problem, which can't be corrected any other way. Do so under the benefit of an anesthetic that allows you to have this in a pleasant environment, reemerges you and sends you back to health. That particular form of medicine is always going to be with us. We're always going to be needing it, and no one should be looking for a substitute. We have some of the best surgeries in the world. However, the moment you walk outside the surgical suite of any hospital, you now walk into dirty medicine. Dirty medicine is the treatment of chronic disease. Because you see, in treating chronic disease, there is no way to correct any of it. The doctors will always fail because they cannot conquer disease. The best they can do is listen to your complaints. Upon listening to them, their job is to shut you up. And they'll do so if they can think of a medicine that's able to suppress what you're squawking about. You have a symptom. It's not agreeable. You want to get rid of that symptom, and the doctor's going to take a guess at some drug that be able to do just that. If he guesses right, you put him on par with the reincarnation of the Messiah, feeling that his skill is so wonderful that you've now gained trust in him. And what he has just done is criminal. What he has done is taken that symptom, which was the only way your body could tell you something wasn't right. And it was recognized by you as something disagreeable. But he went, and because he picked so well, the medicine he chose took the symptom away. Now you're feeling comfortable. But what he did was he took the only visible sign that you had a problem, he crushed it and he pushed it below the surface of the skin so that now you have no awareness that anything bad's going on. But I will tell you this, that pathology continues to move down the road. And that pathology is going to rear its ugly head someday in the maybe not too distant future. And when it rears its head the next time, we're now talking about the mortality issues of your life. And so much better when I began to learn about, I think people call it alternative medicine. Some people call it integrative medicine. Some would describe it as holistic. Quite frankly, some of my colleagues would describe it as voodoo. But nonetheless, it was reason that I left the anesthesia world. I moved into the realm of the integrated world. And from that point forward, life has really changed because the goal of mine is to be able to find out what is the cause of your symptom and then correct the problem so that your symptom goes away because you no longer have the pathology. To me, that's a much better mousetrap. To me, this really does have merit because when you're able to reverse the pathology, you literally aren't suffering from that condition anymore. In my world, it's taken as a given that the very first two things that will be done in every single patient that I confront, we are going to have to correct all of their deficiencies. You are loaded with them. Your diet was what it was. And in our world of today, there is no more nutrients in our soil. They're already exhausted. If you had the perfect diet, you still can't meet your nutritional needs. That's why you need a nutritional frontiers. That's why you're here. Because in your foods, even if those selected well, you can't meet your nutritional demands on a daily basis. The second thing that gets done universally with every patient that I ever meet is to remove their toxicities. Sound familiar to you? There's a whole array of substances in this building to do just that. And every single one of you wouldn't think of just supplementing yourself without also occasionally, if not so even profoundly and like non-ending, detoxify what accumulation of these toxic substances have become in your life, well, they have to be gotten rid of. So I'll put those two things out there as a given. I'm not going to talk anything more about supplements for the rest of the morning. I'm not going to talk about detoxification. We have tremendously interesting ways to compensate for both, but that's not going to be my discussion today. You're all so aware of these on your own. If you ever need my help, I'll be happy to facilitate the use of pretty much doing most of this intravenously because that's my advantage. I am a medical doctor and I'm allowed to treat using the distribution of your blood supply to carry materials in and out. Today, what I've decided to talk about instead are specialty treatments that I offer on a daily basis that you cannot find anywhere. No, I take that back. There are enlightened doctors all over this country that, in their areas of the United States, they offer very similar treatments as good and as well as I'm able to offer them. There are a couple of things I do, however, and you'll soon learn what they are, where nobody offers that treatment other than me. And I'm quite proud of that. And you'll see my pride showing through once I get there. So I've given you a list. I would look for you to get a copy of this, a list of 11 treatments that I won't spend much time on, but I'm going to go down through them and I'm going to give you the idea behind how these treatments work, what they do. And then, according to Mr. Messino, we're going to have a roundtable discussion where if you do have additional questions, I'll be more than happy to answer them. So let's start this off by not starting with number one. I do want to move down to, let's see, we are at number 9. So way down on the list, and I don't know why I waited so long to write that, but I just got done telling you there are some things that I do that are done in no other doctor's office in the United States. And to be braggadocious, that may even extend to the rest of the world. Of course, this is the brainchild of a very famous Pittsburgh doctor that I think you all got to know a number of years ago. I'm talking about in the 1990s. We had an ophthalmologist here in Pittsburgh. His name was Dr. Edward Condrot. Dr. Condrot and his very famous partner, Condrot and Stout, were on the radio. By the way, we all listened to the radio back then. Not many people do today, but that 50,000 watt blaster, KDKA, had commercials for Condrot and Stout every 10 minutes, I swear to God. But in 1998, Dr. Condrot came to me and he said, Dr. Courtney, I want you to do me a favor if you wouldn't mind. And I said, Ed, what is that? What do you need? He said, I would like you to teach me about all these alternative treatments that you do. Now, what you have to understand is there is no school to learn what I've learned. You don't go anywhere and have somebody teach you this. The only way you acquire these skills is if you're really lucky, you become mentored by someone who's been doing these treatments for a career. I was lucky enough to be mentored by such an individual, but I have an obligation. And the obligation is if I'm ever confronted by any doctor who requests of me to help them in learning what I know, I'm obligated to teach them. That's how you pay back. And so I did that with Dr. Condrot. Now, here am I, an anesthesiologist in medical practice now outside of the OR. I never had, I don't mean this in a demeaning way, but I never had any interest in the eye by itself. It just didn't occur to me. But of course, Dr. Condrot did. And it was Dr. Condrot that took all those things I taught him, and he applied it to the treatment of the eye, and especially to a group of diseases that have no treatment and that lead to total blindness. These are things such as glaucoma, macular degeneration, wet and dry, diabetic retinopathy, retinitis pigmentosa. The list moves on, but the one unifying factor in every single one of these diseases is number one, they're all diseases of the retina. And number two, in the conventional medical world, and I want to underline this, you need to take this part home. There is no conventional treatment that can do anything to reverse, stop, or delay the further progression of those diseases. So, as brilliant as the ophthalmologists may be, and they're very brilliant people, they are hamstrung, they are hogtied, because with their tools, and they have three, the same three tools that I have, and they are surgeries, procedures, and drugs. And ladies and gentlemen, anytime you try to take on a disease with those three things, you are destined to fail. Why so? The reason is that the forces behind the disease are so strong that there is not a drug or any procedure that can kill it. And by the way, we are literally taught to take on a disease, we're supposed to choke it, we're supposed to squeeze it, we're supposed to hammer it, we're supposed to beat it with a club. And anytime you do that with whatever tool you have, you can't win at conquering a disease at all. Unfortunately, when talking about the eye, this means we're moving toward blindness. And this, I've been told by some patients, and at first I didn't quite understand, but now I think I do. They openly tell me, look, I'd rather die than lose my sight. And I have had plenty say it up to now. So Dr. Kondrat did put a wonderful program together. He came back through Pittsburgh. Every time he came through, he told me to shut down my practice, and he would have people come from all over the world to the Marriott Hotel out by the airport for a 3-day program. He would say that 85 to 90% of those patients who participate in this program will have a substantial improvement in their vision in 3 days. Glaucoma improvements in 3 days when there is no such thing. MACD, diabetic retinopathy, people are jumping 5-7 lines on an eye chart. Their fields of vision, this is in 3 days. So at first, I was the onlooker. He's using the treatments that I taught him, but because he's focused on the eye, he's actually having those results. Dr. Kondrat passed that skill on to me. I became very conversant. In fact, I became so good at these programs that he quit doing them. He started to play. He bought a boat and he did something called a loop. Well, he wasn't the loop, by the way. You set sail from Florida. You go up the coastline. You enter the harbor in New York. You go up the Hudson. You cross into the Great Lakes. You travel over, I don't know which one of those actually ends up being the mouth of the Mississippi River, but you come down the Mississippi River, you exit in New Orleans, and you go back to where you started. That's the loop. Probably took 8 months to do the loop. I'm teaching and I'm doing all the programs while Dr. Ed has his feet up on the deck of a sailboat. I'll say this, the guy is fearless. He actually, without knowing how to pilot a boat, did that. I say he's crazy, but what the heck? small disagreement among friends. But I got so good at this that I had to do what Ed never did, and I don't know why he ever did it. I wrote the book. I've never written the book. I wrote the book that's the manual for how you can reverse these eye diseases in 3 days. We do these programs here in Pittsburgh once a month. So I say this to you, and we're going to let this drop at least as our starter discussion. I sure hope none of you in here have such an affliction. Okay. If you don't, however, you certainly know somebody that does. Now, that may be a family member, and you see the tragedy unfolding in front of you. Their very intelligent doctors are using a phrase not even allowed to be uttered in my presence, which is nothing can be done. Not allowed to say that in front of me because everything can be done. It can be done in 3 days. And this book is the manual on how to do it. I thought at least that's as much as I should be able to tell you today to let you know, carry this message. People look to you as the adjunct, the connector to health. And by golly, they look at you as being, hey, if something's going on, I'm going to talk to so and so. They always know what to do. You know, you're relied upon, okay, for that kind of information. So if anybody has any of these serious eye diseases, you absolutely want to come to Pittsburgh. By the way, they come from all over the world. Europe, Brussels, England, Africa, India, Australia. The woman says she crossed 17 time zones to get to Pittsburgh. 17 of them. I never counted. She sure did. But she was extremely grateful for what happened to her while she was here. So let that brief discussion carry you in good stead. You are my messengers. You were here today. You're able to spread this word to help someone who's going down a pathway where there's nothing but terror at the end. And if it's glaucoma, that's the number one cause of total black blindness, and you don't want anybody to ever get there. We will not only stop the disease immediately, the progression will be no longer, and we will reverse that disease and have a substantial improvement in your vision in 3 days. Folks, whoever has someone in that situation really should be coming to talk to me. Let's move on. If this comes up in our roundtable, I'll be happy to go over it further. So now I'm back to the top of the page. And I'm starting with number 1, and I'm moving down the list. And so our first therapy, specialty therapy, a therapy that you cannot find here. It's not here. I do this therapy. This is the brainchild of what we call the godfather of ozone therapy. His name is Dr. Frank Schallenberger. His practice is in Carson City, Nevada. Anyway, 40 years ago, Frank brought this therapy back from Europe, and he's been the sole motivating force in spreading this word through the medical community. He has trained 269 disciples, of which I'm proud to say I am one. We are able to treat with ozone, which I feel has 2 benefits that I know of no other treatment in my armamentarium that can do these. Number 1, ozone. By the way, what is ozone? Oxygen is O2. It is life-giving. It is life-supporting. But if you add another atom of oxygen to O2, you wind up with something which is O3. But the only contact you have with ozone is, did you ever notice after a thunderstorm, and when you walked outside, there's an aroma in the air that's very distinct after a thunderstorm? That aroma is ozone. And through electrical forces, that was formed because it was a lightning storm. If it's a storm without lightning, there will be no ozone. If there's a large output of energy, there will be. Anyway, we can manufacture it in our office by using an ozonating machine. We deliver ozone intravenously. The very first thing about ozone that I depend on is it is the best of all bug zappers. What I mean by that is, as a medical doctor, I'm trained to go after these bugs. And by the way, there are 4 of them. They are viruses, bacteria, parasites, and fungi. 4 bugs. In the world of medicine, I'm supposed to think and guess. What category do I think I'm dealing with? That's my first chore. Second, after I guess, I need to guess on if it's a bacteria, the antibiotic, or the antiparasitic, or the antifungal, or the antiviral that I need to use to help conquer the infection. I may guess wrong. And by the way, even if I guess right, the antibiotic or the antifungal doesn't rid you of the disease. It is your own immune system that does that. You've heard of AIDS. Those poor people have no immune system. They die from infections that a 6-month-old child could get and be over with in a day. Why? Because they have no immune system. So therefore, it doesn't matter what antibiotic is used. But in my world of ozone, I kill anything that moves. What an advantage. I don't have to guess. It doesn't really even matter what the bug is. I have my guessing, but I'm able to conquer all of them. And the public needs to know that. Yes, you can rid yourself of an infection without ever using an antibiotic, which would be the one reason you would go to a doctor anyway, because you know how you feel about doctors. Yet sometimes you're just put in a position where, and it usually is an infection, where you need some help. So that's the amazing thing that ozone could do. The number 2 thing that ozone can do, that I know that there is nothing in my world of medicine that can, and that is this. I'm able to correct, improve, and optimize the function of your mitochondria. Now let's package that little thing in a nice way. So you've got 30 trillion cells. Yeah, you do. That make up your body. Every one of those cells has inside it numerous mitochondria. And the mitochondria are the powerhouses of a cell. Inside of the mitochondria is where you metabolize your foods that you take in. That's where they get burned. And when they get burned, they form the chemical form of energy that we all need, and that is called ATP. So all energy we use in the body are due to how much ATP do we make. Okay? So what I learned was this. Then the healthiest person that you could ever think of, the ratio of being able to optimize the mitochondria is this. And by the way, I used as my example when I was thinking about this as Lance Armstrong. Now, I know Lance had some problems with ERO, erythropoiesis, okay, EPO. Anyway, but when he was pedaling up the Pyrenees, the way I figure it, he was a machine. Wouldn't you agree? The man actually had a smile on his face. You and I would be, well, no, we'd be pulled off. Let's not even have, well, we won't even try to put ourselves in his position. But the man was a machine. And so I had to use him as my example because I say that in the healthiest person that could be known to man, the ratio is for every mole of fat that you consume. Why do I use the word fat? Well, there's three things you can put in your mouth and eat. There's only three. There's carbohydrates, there's proteins, and there's fat. Of those three, the one that contains the greatest potential for energy is the fat. So, science has told us that for when you're at your optimal mitochondria production, for every mole of fat that you consume, and don't get hung up on the word mole, you want to put in the word pound, you want to use ounces, I don't care what you use, but the scientific explanation uses the word mole. It's a measurement. For every mole of fat that you consume, you can make up to, but not exceed, 43 moles of ATP. So the ratio is 1 to 43 in Lance Armstrong. Now, how about in us mere mortals? Where do you think we are, folks? I mean, I don't know. I'm low 20s. Bring in disease. Where are we going? Well, I think we're easily getting into the mid and lower teens. And heck, it's even possible in some people in the final stages of their disease, they're in the single digits. When I learned that ozone can augment the mitochondria to make vastly greater amounts of ATP, I knew I had a winner. And for that reason, I use ozone in the treatment about just about anything that walks into my office. Because you can't, not everybody has bugs. But if they do, I'm thinking of a 18-year-old girl who walked in my office and she had tears coming down her face and she was crying. She was telling me how she had genital herpes. Her vulva was on fire. She could not sit. So I said, you're starting ozone today. You'll be doing ozone every day of the week for the next 2 weeks, then 3 days of the week for 2 weeks after that, then Tuesday days a week for the 2 weeks after that. Then when we're down to once a month, we're going to recheck the viral load. Well, within 48 hours, she could sit in complete comfort. And it is now 5 years later. She has never had a reinfection of genital herpes. She has had children. Life is good for this young lady. And I think ozone really put itself at a level of prominence because of it. So I'm letting you know this little special item, which you could only receive from somebody who was trained by the Godfather himself, is what's available in my office. Think of it, maybe in your case or somebody else's, as being life-sparing because it truly is. I move on. Next thing is listed as regenerative medicine. As an anesthesiologist, you have to understand that the world of chronic pain is my realm. The pain clinics of this country and of this world are always run by an anesthesiologist. Nobody ever managed a pain clinic who wasn't an anesthesiologist. So, in part of my training, I was taught to treat chronic pain. I learned how ineffective that really was, and I had to go off and elsewhere to actually find things to solve the problem. The reason I mention regenerative medicine is I find a lot of people with advancing age have joint problems, usually attributed to degenerative arthritis, and they are confronting the issue of a joint replacement. They have an orthopedic surgeon who's telling them they need to have a surgery. And I'm telling you, oh, no, you don't. There is a way to regenerate diseased tissue and make it healthy again. For many years, that was through the use of injecting into the joint something that I think you've heard of before, and they were called stem cells. Well, I was in the realm, I used those stem cells, they were very effective. However, on May 31st, 2021, from that day onward, stem cells were illegal. Why so? Well, some companies got involved with processing these stem cells. By the way, they come from the umbilical cord and placenta of newly born babies at a scheduled C section. Anyway, their sterility issues were not that great. And what happened is they put out a product that was contaminated and people got hurt. When the FDA sees an unapproved substance hurt somebody, you get shut down. The whole industry closed down overnight. And the rule became the only way you're legally allowed to administer stem cells is if the product you intend to use is currently in a FDA approved research program, a study. And because stem cells are considered a drug, the study at a minimum is going to be over $80 million, more likely over $100 million. And the only people that can play that kind of ball, they're called Big Pharma. The game is rigged in favor of Big Pharma. The people who owned these companies didn't have 100 million. Stem cells are no longer being developed because they can't afford an FDA study. What does, however, meet the test are the injection and use of exosomes. I've switched to them. I actually switched to them before the government shut stem cells down because I found them to be the better product. And here's why. Whenever I administered stem cells, let's say in a knee, and the knee is surrounded by a capsule, so I would inject the stem cells in that capsule between the two bones. Those stem cells are trapped in there, right? They can't get out. And therefore they land on something. And whatever they land on, I used to say, then they become that which they land on. And there's 4 different structures inside of that knee. There's bone, there's cartilage, there's synovial membrane, there's ligaments, and there's tendons. We get to regenerate all that. However, what I didn't say at the time is that it's not really the stem cell that does that. What happens is the stem cell gives off from inside of it particles of RNA, mRNA, natural, not synthetic mRNA. Seems to be a little problem with that. We'll get into it in a minute. But RNA, which a stem cell you can see under a microscope. It's big. Nobody can see a particle of RNA. Only an electron microscope can do that. And so it's the stem cell that gives off from inside of it particles of mRNA, and it's the mRNA that lands on those structures, and it's the mRNA that does the work. The stem cell was the pizza delivery boy. He delivered the mRNA. And that's why these procedures were so successful. So companies got sophisticated. There are a few that were able to harvest only exosomes. You need to know that if you've got chronic joint disease, that you don't have to be left with the decision of ever having a joint replacement. This is probably something you'd want to avoid. I'm now giving you a reason to let you know that you can. Let's move on. I see the number 3 on my list. Allergy correction. I don't know how to use the. See, For a doctor to use the C word, it, I can't use it. The C word is cure. Thanks for saying it, Joe, because I have a tough time. However, I have to use other fluffy words because I can't use the word that Joe mentioned, which was because Joe said it, was the word cure. Anyway, we have people, medical doctors, that call themselves allergists. They're quite easy to find. And of course, I had the opportunity once to meet an allergist, and he made a big mistake. Big mistake, because I innocently asked him, I said, "Hey, do you mind if I ask you a couple of questions?" And the doctor said, "Well, no, please go right ahead. Ask me what." Biggest mistake he ever made. I think an hour and a half later, and I'm sure he felt that there were spotlights on him and he broke out in sweat because I just hammered him. I had a lot of questions I needed to get answers to. How about these for some answers that I'm now going to share with you? Here's the first. When he told me this one, I fell off my chair because he told me, by the way, I'm not allowed to treat any allergies except inhaled allergies. I didn't know that. I said, well, wait a minute. You're an allergist. You should be able to treat all allergies. And by the way, foods are a big player in the world of allergies and responses that you all have and can have. He can't touch them. Not allowed. He would have his license revoked if he ever tried. And then, of course, the third category are chemicals. So the only thing he can treat is inhaled. And, all right, there are people that have inhaled allergies. I'm sure they enjoyed going to their allergist. He did skin testing on them where he could read what they were allergic to. And then he made a serum at a dilution of 10 to the fifth. Now let's do a quick summation of what 10 to the fifth really is. That's 5 vials of water, 10 milliliters high. And into the first vial, you put 1/100th of 1 ml of every single one of those things that lit up. Let's say this particular person, 5 things light up. He makes a serum by adding those 5, 1/100th of 1 ml into vial 1. So if there were 5 of them, 5/100ths of 1 ml go in total, and you shake it up. Then from that first vial, you take 1/100th of 1 ml from that vial, and you put it into the second vial. Shake that up. Well, that's a pretty big jump, don't you think? And then you take 1/100th of 1 ml from the second vial and into the third, and shake into the fourth, shake. And when you hit to the fifth, you're thinking there's much of this antigen in there? Do you think there's much in there at all? Most people would think, my God, there's nothing there by the time you get to 10 to the fifth. Well, you would be wrong. There are people who went to visit their allergist and died in his waiting room because in some individuals, that is a whopping dose of antigen. So there's that issue. It's rare. Most people aren't that sensitive, but there are people that sensitive. So the next thing I found is that, he would tell you to come to his office. He would administer that serum subcutaneously. And when he gave it subcutaneously, it formed antibodies against those 5 antigens, and you actually felt better. You felt good. The patient really liked his allergist because it made him feel so good. They could breathe where they couldn't breathe before. And then the allergist says, well, by the way, I'm very happy to see that you had that response. And by the way, the antibodies that just formed have a lifespan of 14 days. We are not going to wait 14 days to re-inject. No, no, no. We're going to be seeing you every week for the rest of your life to keep you healthy and breathing just fine. Boy, when he told me that one, my mind was going. So, with those few facts that I share with you, let me talk about what I use to treat not just inhaled allergies, I treat them all. And the word that I can't use, that Joe used, is actually within my purview. How so? Well, we have to thank a doctor. His name is Dr. William Butch Schrader. Dr. Schrader's office is in Santa Fe, New Mexico, who's a little geographically undesirable to you who live here in Pittsburgh. Anyway, he introduced in 1993 this treatment called LDA. LDA stands for low dose antigen. And in the world of Dr. Schrader, there are 3 vials of antigens. There's 1 vial of inhaled allergens. And by the way, every antigen known to man of an inhaled nature is in that vial. The difference is it's at a dilution of 10 to the 17th. Remember when we were 10 to the 5th? People were dropping over like flies inside of people's offices. At 10 to the 17th, you are 3 short of homeopathy. And at 10 to the 17th, nobody's going to be dying at all. And therefore, I have a vial for foods. Every food known to man is found in that vial. If it's not found directly, then by algorithm, let's say somebody from Brazil is up here. I don't know what they eat in Brazil. Do you? I'm not so sure it's in there. But an algorithm has allowed for the cross-reactivity to make it covered. So I don't care what you can't breathe. I don't care what you can't eat. And I don't care what chemical may be the cause of your reaction. All I'm telling you is that when we inject that stuff, not sub-Q. The sub-Q, I like to use words that I probably shouldn't to describe what I think of this, because I think that the allergy world does this on purpose. Remember that sub-Q injection that caused the formation of antibodies that lived for 14 days, necessitated you going to see him every 7 to keep the gas in his Maserati at the full? It's full, okay? When you do LDA, you don't inject sub-Q. You inject intradermal. You literally bring up a little bubble of what you're injecting, but maybe unbeknownst to you, even forgotten by me, I had to relearn it. There is a nervous system that resides in your skin. That nervous system is called the dendritic nervous system. And the dendritic nervous system is hot-wired to your lymph nodes. And the lymph nodes are the site of cellular immunity. What gets created in the lymph node is a cell. T cells, you've heard of them, have you not? They're in the lymph nodes. And they're only brought into play through the dendritic nervous system. When you inject into the skin, those 5 things, if we're talking about inhaleds, light up that lymph node, and the lymph node makes a cell. And the cell is called a T suppressor cell. Are you getting the idea? And the T suppressor cell prevents the bad guy cell, which is called the T helper cell from ever forming. And the half life of a T suppressor cell is 90 days. That's the half life. So it really has a full life of 180 days, right? We don't have to inject. Nobody's cash register has to ka-ching every week. We just want to stay ahead of the game, so we're not going to wait 90. We're going to inject once every 2 months. By the time we get to a year, let's talk about the word that we're not allowed to use, and let's see where you are at that point. And the story for now, happy to talk to you about it in another venue. Next, in the same vein that LDA can be used for allergies, and they will correct those allergies, there is also a heavy opportunity to correct autoimmune disease. If any of you are familiar with these diseases, these are diseases that occur when your own immune system attacks organs that you have and recognize them as foreign bodies. And this assault is devastating to these organs. It wipes them out. Nice to know that there is a way to reverse that utilizing very similar injections that I'm talking about right now. You who are my advocates need to know that. You need to put a little marker in the back of your mind. There is treatment available for people that are suffering from autoimmune disorders. When in fact, they need not. Let's move to the next one. Talking about fatigue here. It's not a procedure, is it? It's the name of a symptom. And by the way, this symptom is the number one symptom that I get in my office by just about every patient that I see. And so would you do me a favor and help me pass these out? Now, to every woman, I want the lady who's sitting in the audience. So these are for the ladies. And these are for the men. And while he's passing them out, could you allow me? I'm going to step away from the podium just a moment. Okay. So I only grabbed the hands of the ladies in the group, and what I can say is that I found 3 of you who have a disease. Because what you just did to me happens to me all the time. I'm introduced to people, many of them women, and they throw me the cold fish. Okay? Their skin touches my skin, and the moment they touch, I look at them and I say to myself, are you really going to do this, Courtney? Are you going to really do this again? Okay? Because I find it hard to just like let that lady move on. Okay? That's a serious symptom I've got there. So the word fatigue comes up as the largest complaint that I have. Ladies who are sitting in the audience, you now have a symptom chart in front of you. Please go down through it. The first one might be hard to understand. I say cold hands, cold feet, and 3 of you in here already know who you are, okay? And by the way, that's cold hands and cold feet. They date back to when you were a teeny bopper. This wasn't last week this happened. This happened a long time ago. Anyway, I want you to do, oh, and there's one other, there's one about vascular headaches. Don't worry about the word vascular. It's just if you have headaches, you want to check it. Okay? Now, let me talk to the men for a moment. And you men should really be upset. I mean, you should be frothing at the mouth. Why so? Well, your female counterpart about 30 years ago was feeling miserable. Okay? And they couldn't get doctors to listen to them. But this is when the movement with Gloria Steinem and this recognition of women's rights, and they screamed so loud, and their voices were heard because they demanded to be treated by their doctors. And their doctors were frightened by you women. And you lit a fire under their you know what. And I'll be damned, every single doctor on the planet now makes very certain that they treat women to the fullest. Men, you didn't open your mouth. They screamed, they yelled, they made spectacles of themselves, but they got what they deserved. You men, no. Because we keep it in. We like bite the bullet. We don't make a big thing. Well, in front of you men, I have a questionnaire. 10 questions that I use in my office every day. And so you go on down through there. Women, if you have more than 4 check marks, you have more than 4. What I'm about to say has value to you. And men, if you have over 4, you're in the same category. Hormone replacement therapy of all types is what I do. But this thing with the thyroid knocks them all dead. Ladies, you have made my life miserable. Why? Because you throw me that handshake, that cold fish, I can't keep quiet, I open my mouth, and you ladies let it out. You can't wait to get home and say, I met this doctor, he's shook his hand, and you say to them, I met a doctor who listens. Why did you say that? My life's been miserable ever since. I've been assaulted by you women. I've got 3,500 of you women that I treat. Because you don't know is you live and were born and raised inside a geological phenomenon. We, here in this area of the world, had something happen to us that happened in no other part of the world. And because of it, all you ladies are miserable. By the way, I commend you, ladies. Being so miserable as you are, how can you be so nice in public? You have a smile. If we men had to suffer, would you suffer? We could be unapproachable. We would be the most ornery and individual that you want to run away from. You ladies have been able to meet the grade. You're so appropriate, yet you suffer with your mouth closed, I guess. Because those symptoms on that sheet are devastating. And you've come to, that's just your life. Do I have anybody in here who's been diagnosed with hypothyroid? Anybody at all? Okay. So in this one woman's case, she was so sick with her thyroid that her TSH, which is a lab test, TSH is secreted, that's thyroid stimulating hormone, secreted from your pituitary gland. And it's the pituitary gland that stimulates your thyroid to make thyroid hormone. But your TSH was so high, it was over 4.0. I know it was over 4.0 because your doctor couldn't miss it. He had to be led to water. He wasn't asking you any questions about how you feel, but when he sees 4.0 or above, he knows you're hypothyroid, for which he puts you on Synthroid. Did he not? Ma'am, you have a problem. You were put on a drug, the number one, and knowing you're here, you're not going to like this, but I mean, this is it's synthetic. Why are you doing synthetic anything? Why are you doing that? We don't do synthetic anything around here. Okay. So, on that count, I have to tell you it's a mistake. But the other reason is a bigger mistake because this isn't only synthetic, it's synthetic T4. It is called tetra iodo 4 iodo iodine. Tetra iodo thyroxine. That's what the gland makes. But that's not the active hormone. You have to cleave off through a hormone one of those iodines to make T3. And it is T3 that's the active hormone. And if you can't do that, you can have a truckload of T4 and you're going to get no benefit whatsoever. It just won't work. The lab shifted. So your doctor sort of in this way went, oh, by the way, oh, yeah, look, that last dose that we used, you know what? Yeah, that's working out pretty good for you because you're right now, your labs are right. So look, we're going to stay with that. Never looked at you, never asked you anything. That's how they determine what dose you've arrived at. It's just wrong because that doesn't mean anything. The labs, I cannot trust the labs when it comes to this. So ladies, you need to know there is a rescue available for you. And that because I don't use labs, if you ever come to see me, I have to give you an extra credit book report before you ever arrive. And here it goes. If you're ever thinking about seeing me for your disease, you don't come to me unless you've done two things beforehand. I need 4 days of basal pulses and basal body temperatures. I have to substitute something for those labs because I don't trust those labs. I don't use those labs. I have to order them to be medico-legally correct, but I don't use them. I use you. You're my lab. How you feel is my lab. And every one of those symptoms that you experience, I need to have go away. That's when I know we're at the right dose. But I need to quantify something when I see you, and I can know more from what your basal pulse is. Meaning, when you awaken in the morning and your eyes open for the first time of the day, at that moment, all of your body function is due to one thing and one thing only, and that happens to be the amount of circulating thyroid hormone in your body. You don't have any, or you have minimal amounts, and as a result, your pulse will be extremely low. I need to know how low. So I need you to take your pulse when you open your eyes, before you get up, before you sit up, before you get up. I need to know what that pulse is because that pulse tells me quantifiably how far off you really are. The second thing that's required of you is make sure you present me with 4 basal body temperatures with a digital thermometer either under your armpit or under your tongue. And I'll be able to tell through those two how bad you are. By looking at those lists, I already know you have the disease. And even if you are being treated with Synthroid, you still have many of those same symptoms that you once had. And it's because it's the wrong way to treat. So let me swing away from the ladies now and move to you men. Men, you kept your mouth shut too long. You're just as miserable as everybody else, but you bite the bullet and don't say a thing about it. If you've looked at those 10 symptoms that I asked you about, and you've got over 4, and I know that many of you men here are well over the number 4, you need to have your testosterone treated. Problem, you can't find. I know you have a very friendly PCP, don't you? Maybe you're buddies with your PCP. You try to have a conversation with your PCP about testosterone, it will fall on deaf ears. The whole conventional community is too timid to take you on. But at Regenesis HRT, which is the wing of my practice that treats men and their hormonal problems, all you have to do is make an appointment, go online, find Regenesis HRT, and within 2 months, you will have, I don't care how old you are. I've got 3 80-plus-year-old men who are on this, and you would have to wrestle the testosterone out of their hands because they enjoy life with normal testosterone ranges, and none of you men have normal testosterone ranges. That's the lab we get before we even see you. So we move away from fatigue now. There is a hormonal correction. You need to know about that correction. It is all possible, and it will and can be done. Number 7, I challenge Joe with a term about a month ago. I said, Joe, and by the way, Joe, like, he knows a lot of medicine. You can't pull one over on Joe. But I sort of thought I might, and I said, Joe, I'm going to bring up a term, and I'm going to guess that you don't know. You've never heard of it before. And that's a pretty big challenge to Joe, who actually listened to me and said, with a bit of a smirk, oh, Doc, go ahead. Lay it on me. So, as he well knows, I said, Joe, are you familiar with something called anthroposophic medicine? And just as dumbfounded as you are, that was what Joe presented to me. I didn't expect him to know about it. Anthroposophic medicine. So there's allopathy. That's medical doctors. And their primary thing is drugs. There's osteopathy. And they're a combination of drugs and chiropractic. There's chiropractic, which is use of manipulation only. There's naturopathy, where we never use drugs, but there is a plant substance, an herb, or some other material that can do the job just as well. We have herbalists. We have the Oriental form of treatment. We have all these forms of treatment. In Europe, however, anthroposophic medicine thrives. And it treats the entire person in a way to describe it now would take so much time that please allow me the indiscretion of not getting into that definition. But one treatment in the anthroposophic world has such value that I had to introduce it into my practice. And this is a treatment known as mistletoe therapy. Mistletoe. Are you kidding me? Mistletoe? Yes, mistletoe. And this happens to be in the realm of patients who are afflicted with cancer. Now, my hope is that none of you in here have that affliction, but as luck would have it, in your family, in your sphere, you have people right now that have the diagnosis of cancer. You see what's happening to them as they go to their radiation and chemotherapy. They literally are withering away in front of you. It is a terrible thing to have to watch. And those people who are wealthy, you may have heard, because I sure have, how when they have cancer, they go to Europe. You ever hear this before? They have the money, they go to Europe. And when they go to Europe, what do you think they're going for? Anthroposophic mistletoe therapy. Because in Europe, this thrives. And so the reason why, if you know somebody or if you're going in your acquaintances to meet somebody that has a cancer and they're going to the Hillman Center, supposedly number one medical institution to treat cancer on the East Coast, okay? You are not going to find mistletoe therapy available. They never heard of it. But what mistletoe therapy allows you to do, because there are extracts that are taken from these mistletoe plants, not in the United States. Back in frontier time, one of our guys walked in the woods. It was the middle of winter. He looked up on a tree. The tree had a plant that was thriving. I mean, all the leaves and the flowers and the berries. He looked at it and said, "What the heck is this stuff?" He goes, I think we could use that for putting it over the hearth, and we should kiss under it during the holidays. Yeah, let's cut some down, take it home, put it up, and that's the folklore that we get presented with even today. That's what we thought of it. And probably so too, because actually any species of mistletoe plant in our country doesn't have a medicinal use anyway. But I just think it's unique to find out we're kissing under it in other countries, especially in Europe. The plants the mistletoe plants that are raised in Europe have a large amount of something called viscum album, and they're able to extract this material and process it. And with the use of mistletoe delivered sub-Q, you can go through chemotherapy, have your hair, not lose your hair, smile and engage, not lose weight, be a human being in a world that right now you can't. If you ever walked into the Hillman Center, into their main IV room, you'd have to run out, because I know I did. I couldn't take it. Could not look at that. Well, in Europe, that doesn't happen. And in Pittsburgh, that doesn't have to happen. Because there is a doctor, I know him pretty well, and he does do mistletoe therapy. There is only one pharmacy in the entire United States that is allowed to dispense viscum album, and one only. And so that's the pharmacy I use. And that's when it's administered sub-Q. You literally treat yourself. But if we take the next step, and we can, and we administer it IV, you not only are able to maintain your QOL, quality of life matters. And even if you have cancer, if you decide to have chemo, which I sort of question anyway, but I always go with what a patient says they want to do. If they say, I want to do chemo, I roll out the rug. I'm there to help them. I'm going to support them 100%. I have the other people that say, I would never do chemo on a bet. So I see all the factions that are out there, and I deal with them all. But if we do this IV, we're actually able to add on years of life besides QOL. So that's my message today. You now know there is such a therapy, weird as it might sound, and that I don't know of any other doctor anywhere that does this. And so that does make me unique in two ways. With the eyes, I'm it. And with mistletoe therapy, I mean, also, so if other questions develop, if you find somebody in your sphere that suffers from cancer, doesn't have to be going to chemo. We want to maintain that immune system. That's what happens with mistletoe therapy. We keep the immune system excited. We keep the immune system capable of functioning, where chemotherapy kills your immune system. You have no immune system. And that's why you deteriorate so badly, because the one system that you need after the first round of chemo, you no longer have. So carry the message well, we move on. We've just gone through a terrible pandemic.
Doctor,
I'm not.
sorry to interrupt you real quick. Do you mind if we move COVID to the end of your presentation? I'll have to take us offline for that because we're going to get banned on YouTube if we talk about COVID.
All right.
So,
I'll put it at the end.
Thank you.
Okay. So we've already essentially talked about Regenesis HRT is a wing of my practice that deals with all hormones. All hormones. The thyroid is done in my office only by me. All the other hormones can be dealt with by the rest of the staff. But women, you appear to be doing all right with your care. You screamed loud enough, as I've already mentioned. It's getting done. Men, you got no hope of getting this turned around unless you visit somebody like me. But all that is reversible. All those symptoms that you're reading about, they're all reversible. And therefore, any of the other hormones that we need to use are done through Regenesis HRT. Head to their website at regenesishrt.com. I am the doctor who's in charge of Regenesis HRT, and eventually I have to evaluate you anyway. I just want you to know there is a vehicle to take your complaints to that go far and above your conventional trained doctor. And we'll let it go at that. The last one, before you can turn on.
I never use that word anyway. I don't give it any energy.
Hey, this is the name of a real disease. I don't know what your problem is. I don't intend to say anything that would do anything else than open up and shed light on the availability of what treatments are out there. And I think that's my job as a doctor to do. I'm not going to encourage the use of any specific treatment right here and now. That's reserved for another time. So what spooks you does not spook me. So have it as you will.
What else is there? Keep going. What else is there? Just don't say it. Say flu.
So we had a meeting of the minds a moment ago. I do want to share a couple things with you. One, we've just gone through a terrible time here. I think we see ourselves coming out of that time. And I can just say that during this, when there were no treatments for the plague that we all encountered, at least for the first year, there was nothing. Okay? There was nothing. But there always are treatments that are available if you pursue them. And I suggest you talk to me in another forum if you ever are afflicted with this particular disease ever again. Number two, many of you who were afflicted, either yourselves or you know somebody who's considered to be a long hauler. These are people who remain with symptoms way much further than the actual disease itself. There are people who got this disease in March of 2020. You understand the virus is dead in 5 days. It's dead. Any symptoms that continue beyond the 5 days are not due to the virus. It's gone. It's due to the release of cytokines, which is what that virus disintegrates into. Those spikes that you see in the picture are all cytokine provokers. And a cytokine storm develops, and wherever those spikes land, that is now on fire. And that fire has to be put out. And we have the means. We always had the means to put it out. But the more tragic thing I think I want to get across to you is the person who had the disease in March of 2020 has the same symptoms today that they had in March of 2020. So long hauling literally means long hauling. And there is no treatment in the conventional medical world for it. But I'm here to tell you there are things to consider that very well may be helpful in that regard. Now, the third category, because we're not done with this. We have vaccines. There's a great controversy out there about these vaccines. At least we see that, best that I can see, there's now no longer a requirement that people have to be vaccinated when, we went through that stage. When they did, they lost their jobs, they lost their way to earn money. That all blew up in their face. So as to whether or not you get the vaccine, I'm not here to tell you what to do. What I am here to let you know is that Pfizer, who did come up with these vaccines in their particular product, got emergency use authorization in order to be able to bring it to be used. So it's never been cleared, never been approved, even to this day. It still operates under EUA. What we have now, we do have only recently through a court order. They actually did have 55 studies that Pfizer did before they brought this to the FDA for EUA. You've never seen the 55 studies. They were not to be opened up and a seal broken on them for 75 years. However, a judge 3 months ago demanded that they be released, and they have been studied, and the results of what was learned, I believe everybody in this country should want to know what they are, and there is a publication that can do just that. We can talk about it later. I needed to let you know there is a website that you can go to that is a collection of all the doctors in the country who actually do and can deal with COVID. The name of that website, which I hope you jot down, is flccc.net. This is a group of doctors initiated by Dr. Peter McCullough, Pierre Corey, and Paul Marnick. This is where you find all the protocols, all the papers, and their weekly meetings, which are done over a Zoom call every Wednesday night. But they're all on the site, so you can learn about any one of these aspects because they're archived there. And so for now, I think I've gotten my message across to you about what I wanted to do and bring to your attention with respect to COVID. There's this final area. Odd that it is last, because it was my introduction to the alternative realm. And that is when I learned that there was a treatment called chelation therapy, and that plaque that became deposited on the inside of blood vessels, which is the big one, So when you're talking about occlusion of arteries, that is plaque that builds up inside those arteries. You've heard the results of catheterizations, sort of like, well, the LAD was 80% occluded, the right coronary artery was 60% occluded, the circumflex was 95% occluded, for which we nailed in 3 stents and made those vessels patent, and were able to withdraw the catheter. You've heard that. You know what that is. This has been played out in everybody's family an infinitesimal number of times over the last 40 or 50 years. That's how long it's been going on. But maybe what you didn't know is you actually can dissolve that plaque through the use of intravenously administered substance called EDTA, ethylene, diamine, triacetic acid. I need to get an award for remembering what those letters mean. Okay? EDTA is a legally obtained drug through the FDA that is used off-label to dissolve this plaque. And ladies and gentlemen, I believe every single one of you should consider it. I would say to you that at a minimum, I don't want you to have a cath. So don't go running off, and I don't think you are going to run, to ask your doctor to please cath you. That would not be something you'd be interested in, I'm sure. But what you can do is you can request a Doppler of the carotid arteries. Actually, not just the carotids, but the carotids, the pelvic vessels, and the popliteal arteries are so close to the surface of the skin that by putting a probe over top of it, we know exactly how much plaque is occluding that vessel. And because it's only a representative of blood vessels anyway, if you've got 80% occlusion of your carotid, which is a heck of a lot, then you probably have 80% in many other parts of your body, including the coronary arteries. You should at least find out what the status of these are, and in finding that out, determine whether or not chelation therapy will be something you wanted to pursue. It was my first treatment that brought me into the world of the alternatives. I had an office with 24 lounge chairs. I had to run 3 shifts a day. People came from all over the tri-state area, some traveling 2 hours plus to sit in my chairs for 3 hours and then ride back home for another 2 hours. It took a whole evening or morning day to do it, but they didn't miss. You just need to know that can be done. Now, your doctors, they're another story. For many years, what we got from them is, oh no, that's a bunch of malarkey. No, that's voodoo. They can't do that. Well, before 1995, I believe they could actually say that and really couldn't be criticized for saying it because there was nothing written about it in their literature. But any doctor after the year 1998 that makes that statement is, we're going to be kind here, uneducated, completely unable to be aware of what's known in their literature, because the NIH did a $10 million study in the mid-90s. They published their report in JAMA. That's their journal. And it's known from that publication on how effective chelation therapy is. So if a doctor of today is saying that they don't know anything about it, I seriously question the competence of that doctor, or he has a bias that he can't get over on his own, because everybody else knows through their own literature the fact that they exist. So With all that being said, I've now taken you down through a list of specialty therapies that we offer. I hope you became educated as a result of this discussion. I hope you utilize what you've learned today. And if ever in the future you require my help, my office is listed right on that handout, and that you can pick up a card and take it with you, and just keep me in the back of your mind. If you have a certain problem that nobody seems to be able to get to the bottom to, no matter who you visit, I'm the one that you need to visit, because you're describing my patient. The person that comes into my office says, I've got this, 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 and this. My doctors are treating me with this. I've had it for 10 years. Nobody has made a dent in what I suffer from. So if in filling in the spaces, you come anywhere near to the this and the this and the this, and then they did this and nothing happened, you're the patient that I need to see anyway, because there's always a treatment plan to be able to develop, no matter what the disease may be. So with that, I thank you very much for coming. I'm sure I exceeded my time, but I had this opportunity to get my message out, and I really availed myself of that opportunity today. I hope you enjoyed it. I know I have. Thank you very much.